Hello everyone and welcome to our August condition workshop, where tonight we're going to be learning about how to combine BioTouch with helping TMJ and jaw problems. So you're going to learn the points that you will need to address that and help you through dealing with that condition. By the way, my name is Sherilyn Powelson. I am on staff and outreach coordinator. And it is so wonderful to see you people here tonight. Thank you. Are we sharing? All right. Would anybody like to share what brought him here tonight? Specifically, why BioTouch?
I was in severe pain 24 hours a day, and my pain level was probably around an 8 for many months, for about 4 months. And then was just like, well, what I'm doing at home isn't helping. I'm going to do some BioTouch. So I started having one of the staff members start doing BioTouch on me, and over the course of the next 2 months, my pain dissipated and is now gone. And I'm still getting BioTouch just to keep up. And I first turned to natural medicine versus Western medicine, and BioTouch has just really helped. Like, I'm not in pain anymore at all.
Wonderful.
Only when I chew hard foods or tough things, then it'll flare up. But it's just for the second. It's just for the moment, and then it's gone. So I attribute my health to BioTouch for sure.
Wonderful.
Yeah.
That is great. Anyone else have anything to share? No? Okay. Well, at this point, I'm going to turn our workshop over to Bev and Paul and start teaching you the points.
Good to see you.
Yeah.
So we have little workbooks we're going to give you all here.
Yeah.
Here's your guys. You guys are husband, right?
Uh-huh.
Yeah. There's one there. Oh, there you go.
Thank you.
So welcome. Some of you, this is your first time here. You guys have never been here, right? Dan's never been here, right? Have you ever been even in the center?
Yeah.
Oh, okay. Have you ever gotten a session?
Yeah.
Oh,
okay.
There you go.
He's not new.
So what we do in these workshops is we take, once you get to that little book, the manual, we take a piece of the manual. What we found was when we were doing some PR work, and we sent this to this guy that was interviewing us, the whole manual, and we claim it's really a simple technique, and he when he interviewed us, he went, well, you say it's simple, but there's 17 sets of points in there, and I got really confused.
What? Blew that theory.
So we decided, wow, let's just create little workshops and just pull out 2 or 3 sets of points that address a specific condition, and then that allows people to at least get started, to do at least something they want to work on specifically that they're having an issue with. Do either one of you have a TMJ problem? Or?
Totally, yeah.
Totally, yeah, you do?
Since I was a teenager, so.
Oh, really?
Wow. Okay.
And have they done any medical procedures with it? Or?
No, I got one of those guards,
Uh-huh.
and that wasn't particularly helpful, so.
Okay.
If I'm in a really, and who knows what contributes, I'm sure it's probably stress, but, so sitting up in bed helps. So I sleep sitting up when I'm
really?
in a bad space, because then I can't get that torque on there and it doesn't hurt as bad.
Oh, wow.
But I think I totally cracked the tooth. But these teeth on one side all have like hairline fractures and stuff. So.
Okay.
Okay.
And him too.
Oh, you had TMJ?
Yeah.
TMJ problem?
It's never been diagnosed as TMJ, but I've ground my teeth
You got
Oh, grind
all my
your teeth.
life.
Okay,
Okay.
so just a jaw problem.
tooth cracked eating something soft, so it must have already been
Wow.
cracked. So.
Okay. And Dan, are you dealing with TMJ?
I've got like tension in my jaw.
Tension, right, okay.
You know, it's TMJ.
Yeah, right.
It's like
Yeah, I mean, is there some definitive
No.
thing?
right back here.
Yeah.
in the back of my head, I've been having these headaches that are kind of, feels like it's coming from here and radiating up, but I don't know whether, you know, I would call it TMJ, which
Right.
is a lot of tightness in here.
Okay, wow.
So what we do then is we've also, sometimes we have a speaker. Our speaker today was Michelle, our testimonial.
Yes.
That was good.
You're done.
So it's interesting that you all talked about these different aspects because as we'll go through, we put a little synopsis of what TMJ problems and jaw problems are. So let's just go around, well, we'll just sort of read it. It says the trimandibular joint. And see, that's the thing that's interesting. People always say, oh, I have TMJ. Well, everybody has TMJ.
Right.
Because you all have a trimandibular joint. So it's actually TMJD if you have that particular disorder, and it's a very specific disorder. So the trimandibular joint is actually two pairs of joints that make it possible for the jawbone to rotate and slide. This joint connects the lower jaw to the skull. The trimandibular joints can be found on either side of the head in front of the ears. These joints allow us to talk, chew, and yawn. Oh, that's good to know.
Yeah.
The lower jaw is rounded ends that glide in and out of the joint socket when you talk, chew, or yawn. These are called condyles. They are covered with cartilage and are separated by a small shock-absorbing disc which keeps the movement smooth. It was interesting when we read all that. You know, it's like, oh, you always hear what this thing is. TMJ and jaw problems can occur from wear and tear on the cartilage, injuries, inflammation, which is really interesting because we had a woman, what was it on?
It was on joint replacement. You're
Joint
talking about Sally?
replacements.
Yeah.
And she was a nurse and did research and found out that a lot of our joint problems are actually inflammation. Start with inflammation and then the joint starts to deteriorate. So that was like really good to learn. And then of course that's what we found out here with the jaw problems. And then damage to the surfaces of the teeth due to neglect or injury. Loose or lost teeth that have led to damage of the jawbone or poor alignment of the upper and lower jaws. Poor alignment of the teeth or jaw when biting down. This can cause sensitivity of the teeth as well as affecting the muscles in the temporal mandibular joint. Overuse of the muscles of chewing. This may occur if a person chews gum continuously, bites fingernails or pencils, grinds the teeth, has a habit of clenching the jaw, biting the cheek or lip, thrusting the jaw out when speaking, exercising, or other actions like complaining to my wife. No, wait.
Ooh, payback.
Erosion of the improper movement of the disc, damage to the joint from blow or other impact, arthritis, which is really interesting, trigger points in the muscle tissue that cause myofascial pain syndrome, infections deep in the jaw or other dental problems, and tumors. So you can see, everybody was asking, well, I don't know if this is it or that is it. So it's not, it doesn't matter. It's that joint that we're going to be helping you work with, whatever it causes, even if it causes tension in the neck, creates headaches. We're going to address, those are actually the three sets of points that we're going to be dealing with. Most experts agree that treatment should begin with conservative, non-surgical therapies first, with surgery left as the last resort. Therefore, as an integrative modality, BioTouch has been shown to alleviate the symptoms of TMJ and jaw problems. And we have Michelle who gave us that great testimonial. And we've found that lots of times by just doing BioTouch, which is not a huge, it's not like you have to do this 3 times a day for 30 days to notice results. Okay, I mean, we're talking once or twice a week. Man, how often did you get work done?
Once or twice a week.
Right. Right. So this is not. It's a pretty much no-brainer, which is the problem of getting this into Western society. It's a no-brainer. It's like you can't put it anywhere. It's too simple. How can something so simple be so effective? we're having a hard time dealing with that as we try to get BioTouch out there to people.
Yeah.
You know, so we're appreciative that you all came here to want to learn it,
Yeah.
and our job here is just to be a support system for you. And any questions about the problem itself before we go into? Okay. So for those who've not really ever done it, we're going to start right from the beginning. Now, a lot of what we do in this class is give you a quick synopsis compared to we have a 2-day training or a 10-hour training where we go through the whole thing, more detail of the history. I really give you a song and dance about my history, which I got to do once at an energy medicine conference. That was really fun. But now all of my history and the whole history of how I met the man who created the system is in this little book somewhere.
Where is it?
Is now in this little book, BioTouch Healing with the Power in Our Fingertips, written by one of our certified practitioners. And so she interviewed me, put the history in here, how I met Norman, how I lived my hippie life, and oh, hi. Have a seat, Shay. And so it's all in here, and basically this technique was created by a mining engineer in Southwest Colorado. And I met him back in the 80s, actually 89. This is our 30th year that we've been public. And so we're just in that phase of it. Well, we think we're in that phase where it's now going to take off because we got Shay.
Yeah. We need to give her maybe one of these.
Oh, yeah. We'll sign it, guys.
Yeah.
Right. Yeah. So, my name's Paul, by the way. Did we say that? And you're
You
Bev?
mentioned it.
We mentioned it somewhere? Yeah.
Okay, good.
And this is the Paul and Bev show. If you tune in Mondays on Facebook, it's the Bev and Paul show. But I get taught billing at these workshops. That's what I get to talk
And
first.
you deserve it.
Thank you. But now we're going to let Bev talk because we're going to just sort of start teaching you what BioTouch is all about. Now, if you have questions anywhere along the way, just stop us. It's very informal kind of teaching. So. Yes?
A question, so, I have a bad back, that's why I can't hear almost twice. So do the joints regenerate themselves like bones? I mean, like they renew?
Renew. What? I'm not sure.
Like-
You mean the cartilage and stuff?
Yeah,
Or?
like cartilage?
It can.
Joints?
Yes, anything's possible.
Yeah.
Oxygen is magic.
Ooh. We knew
See?
we liked you around here for
See?
a reason. Yes. So, and it's interesting because now, of course, there's all these techniques where they're starting to do stem cell therapy, injecting stem cell from fat tissue of your stomach. There's some new patches just made by this guy who does the LifeWave patches, and it's not even out yet, but he's created a patch that actually generates stem cell production. So when you start creating stem cell production, which I'm assuming if they did BioTouch research, they would show that the BioTouch can actually help with that stem cell reproduction, and that's what the body starts generating for these joints and cartilage tissue stuff and stuff. So yes, anything's possible with BioTouch. Well, anything's possible with anything.
Right. Yes.
We're BioTouch junkies, so.
Right.
Yes?
Okay, so in your little workbooks, let's go to that page 6. We're just going to give kind of an overview. What is BioTouch for those of you who have not experienced yet? So BioTouch is a really simple technique in that we're using the first 2 fingers of our hands to touch lightly on the skin. The definition of BioTouch is one person touching another person on the skin. So the question always comes up, can you do BioTouch on yourself? And our answer is always, well, just by definition, it's not called BioTouch, but if you can reach those other points, and we say, why not? I mean, if you may be effective, you may not be effective. We don't know. That's our standard answer, by the way. Right, Shay? We don't know. Because it's magical.
But it couldn't hurt.
So, but it can hurt. So, yeah. But if you want to practice, so what BioTouch does is it almost forces us to come into a relationship of healing with another human being. That's what the power of BioTouch is. So let's go to the first bullet. Oh, it's easy to learn. Yes. So tonight, let me tell you that what's going to happen is when you practice together, you and your toys, when you practice together, you're immediately going to be able to help the person that you are giving BioTouch to. Because what happens is, it's a relationship again. So you're going to be practicing with each other, and both of you will be receiving and giving BioTouch tonight, just in the simple sets that we're going to be presenting to you for TMJ and jaw problems. And yes, even children have become certified. It's like Paul was saying the other day, it's almost like BioTouch addresses the child in us. It's so innate in us to want to help another human being, alleviate stress and pain, suffering. That's the only intention, if you want to call it that BioTouch has. You know, we used to say, and we still do, that it's a complementary, not an alternative. But as we progress ourselves in our own awareness, we're beginning to understand that BioTouch is a more of a holistic technique. It begins on the body, for sure. I think of it as a communication system, okay, that goes to the cellular level, but from that, all of our parts begin to open up. So yes, we address the body, as we know. Trauma and pain and disease are held in the body. So it makes sense that we start with the body. We all share a body. We all recognize each other in that body. And so when you step up to another person, that's what's happening. You are entering into a relationship of healing with that other person.
And a key to the holistic part of this is, here at the center, those of us who teach it in this particular center here, is we make no recommendations, we don't diagnose, we really believe that each person knows for themselves what they need. And there's already more than enough information out there on the internet, on all kinds of avenues to go to: massage therapists, acupuncture, all the different other energy modalities. And our only job is to do BioTouch. And then what we've seen with that is we trust that people will come to their own self-awareness. You know, there's a power in this that allows people to hear what they need and have the strength to act on it, which we don't get very many places, you know, and hopefully that's the new trend in healthcare, is giving us the power within ourselves to act on what we know we need to do. So we say, do whatever you have to do. Add this to whatever you're doing, even if you're getting an operation, or sometimes people do BioTouch and they decide not to get the operation. Okay, or they'll go to a chiropractor and the chiropractor will say, oh my gosh, I haven't been able to adjust you. In fact, we're working on a gal now, Amy. The chiropractor's just like blown away how just in the past 2 weeks since she's been getting BioTouch, he's been able to adjust her. And it's staying longer. And we see that all the time with something just so simple like this. And the nice thing is you don't have to come to us. You can just do it at home. You know, that's what's really exciting about this. It doesn't require a center, or like if you learn this today, Dan, you go out and show somebody else how to do it, because you'll be effective and you'll have the information. So that's what's exciting to us. You know, it's just, it really is a holistic practice to add to whatever you're doing.
Yeah. And I think one of the things that makes BioTouch unique is that, as it says here, there are no levels. Somebody like Michelle, who is a Reiki teacher and practitioner, you know, it's different in that you have to master different levels. Well, the beauty of BioTouch is that you don't. The moment you get it, that's it. There are no levels. You are immediately a practitioner of BioTouch. You can immediately begin to use it and you are effective. That's the innateness of it that belongs to every single one of us. Every single person on this planet is capable of practicing BioTouch and of helping another human being. So we have no philosophy, we have no belief system. As Paul said, the power of BioTouch is just everyone already has whatever they need inside to make different choices, to take responsibility for your healing.
So we'll show the power of BioTouch with the ball.
Well, go ahead. You're good. Yeah, don't ask me.
So
Oh,
people
he's-
always want to know why you have touch on the skin, and what is the power of touch? And so, because we don't touch through the clothes, and we don't do the energy modality above the skin. We touch right on the skin. And this little ball is a little circuit board in here with 2 batteries, and then these 2 metal plates that come out. And if you touch the 2 balls, like not a big deal. We'll have you touch one of the knobs there, and I'll touch the other one. And then we're going to touch hands. Now, if I touch it through the clothes, though, I can't get the ball to light. And if I try to do energy work, I just don't have that kind of power to make the connection. But the minute I touch her on the skin, boom.
Yeah.
Oh my God, wait till you see this one. Okay, everybody hold hands in a circle.
Oh.
You ain't seen nothing yet.
So it is a little bioenergetic.
Her be your guide. And then you just want to keep doing that, okay? Or if it was a specific tooth that broke or hurts, then you might just want to get right to that tooth. I mean, this is great for infections of the teeth. Well, like we heard, there's infection and inflammation in the jaw with these problems. So then you just want to do lightly touching around that area. You might come down into the whole, whatever's in there. What do they call it? Lymph system. And you don't even have to know what a lymph system is. You don't even have to know any of that stuff. If you just start sweeping in different areas, but you just want to go slow and deliberate, and then maybe come back to the neck again. Now the other part, like the headache thing, you might get